right.
So tell me a little bit about you, what your scoop is, and why you care about all this.
So, my family has like a very long history in healthcare. My great grandmother was a nurse, my grandmother was a nurse, so that was kind of like my natural progression. And I worked in like an inner city hospital for the beginning of my nursing career and saw truly how like the social determinants of health played into health outcomes. I've now transitioned into the outpatient world, which is really interesting because you kind of see the flip side of that and still how
Mm.
those social determinants of health are really like really determine health outcomes for people.
Yeah,
And yeah, so watching the devastating cuts obviously is like heartbreaking because you
yeah,
just know what that's going to look like for real people.
yeah,
And
for sure. That is for sure. So, and you have young kids, don't you?
yes, I have a 2-year-old and a 3-year-old.
Oh my gosh, you're not busy at all.
Fun.
I love it. So
Yes.
I think about you and people like you, mom working, trying to raise kids. People are stretched so thin right now already. What will this mean for working families if they lose their health insurance?
The consequences will be devastating. I mean, we'll see that in the health of our children, which like we all care so deeply about across the aisle, I think. You know, like everybody wants healthy kids at the end of the day. And when you lose access to be able to go to the pediatrician or the emergency department or worry about having to call 911 because of fear of that bill, I mean, that's just something that a parent shouldn't have to think about. That's something that an American, I mean, we live in the wealthiest country in the world, and that is just something that we should not have to think about. My own patients say these things to me as well. They're, you know, they consider the cost of the healthcare that they need to receive. And it's just mind-boggling to me that in this country, this is such a thing that we have to take into consideration.
Yeah, I think you're right too. I do think that people on both sides of the aisle care about their own families. They care about kids. They want people
Yes,
to grow up healthy and thriving. So it's
yes.
one of the things that confuses me so much about this, particularly on the other side of the aisle from where I sit. There's been a lot of talk about having kids and having big families. And this bill just makes it harder to raise kids, to have kids. So it feels so contradictory to me.
It goes against everything that we stand for and everything that people across the aisle want. It really is just another thing that, you know, my generation and the generation below me have to think about, like when considering the cost of becoming a parent.
Yeah. Well, and you have experience taking care of patients in the hospital and in an outpatient clinic. And one of the big things I'm worried about as a clinician and a member of Congress is that this bill is going to lead to hospitals closing, to clinics closing, both often in areas that are already strained for access. And
Yeah.
I'm so concerned about what that is going to do to America's families, and particularly our most vulnerable. Although I am making the case to people that this is an everyone problem because when hospitals close and when clinics close, that means everyone has less access to the health care that they need. And prices are going to go up because there's going to be more uncompensated care.
Right.
Premiums will rise, costs will go up. Government bureaucracy is going to increase with these work requirements that are being forced on people. It just the hospital and clinic closures are what I are kind of front of mind because I can't get my patients' faces out of my mind of the people that I've taken care of over the course of my career.
Mhm.
What will become of them?
And I grew up in a rural area, so our access was limited to begin with. And I can't imagine as a parent, you know, having a medical emergency with one of my children
Yeah.
and your closest hospital is now closed. And we know that like in an emergency, every second counts. And I just can't imagine like the delay of care that will happen because of these closures. It's just
Yeah. And
mind-boggling.
we already have a maternal health care crisis in the United States long before this bill was passed. And we particularly have a big problem in rural America with access to obstetric and midwifery care. And those rural hospitals are already vulnerable. And they're estimating right now that I think 338 will likely close once this bill is implemented. And the implications for the people that live in those areas is it's kind of staggering. You think about having to travel longer distances. If you've lost your health insurance in addition to losing your hospital, your whole area is going to suffer because in a lot of areas, healthcare is the number one employer.
Right.
So that hurts the whole rural community. You have less access to care. And then if you don't even have insurance yourself, it boggles the mind.
And I think a big part of it is like a lot of people might not realize like the role that our government and legislation plays and policy plays within their everyday life until these things happen, and then they're like, oh my goodness, and kind of backpedaling and having to be reactive rather than like build up these programs that could help all of us.
Yeah, yeah. You know, I'm an OBGYN. I've delivered babies. I'm a surgeon, but I will tell you, and you know this too, healthcare is a team sport.
Oh, absolutely.
None of us can do it alone. We all need each other so that it functions well. And one of the things on my long list of concerns about this bill is that we're going to have fewer people available to take care of patients. We're going to have fewer nurses taking care of people in hospitals. Nurses are an essential, if not the most important member of the healthcare team. What will it mean for patient care and our ability to provide good care if we have fewer nurses in our hospitals?
I mean, I think study after study has shown that patient outcomes are directly affected by staff ratios. So when we have less nurses providing that highest level of care, right, that all of us want and all people deserve across the board, it's devastating. Not only to patient outcomes, but nurse morale as well, because that's why we started, right? Like that's why we got into this was to take care of people and to help people. So
Yeah,
when we are constantly being asked to do more with less, it hurts everybody across the board.
there's no doubt about it. Bri, is there anything else that you would like to share or that you think people should know about when we think about this bill and its implications?
Yeah, I mean, I think a lot of people know the state of like our emergency room situation, basically across the board in the United States. Like there are long wait times, and that is kind of a well-known thing. But what happens when people lose access to like primary care or specialist care, like in my case, is that the only place that they could be treated by law with regardless of ability to pay is the emergency room. So again, that is going to end up just hurting all of us across the board, um, and make everybody sicker. And it's just the thing I keep going back to is it's the most un-American thing that we could have done to our country, is this bill. Which
Yeah,
is
I agree with you. I keep going back to I think it's a national security problem because it's ultimately going to make Americans sicker and poorer, literally.
literally, yeah.
Well,
Of
I'm so grateful to you for taking some time to talk. I'm very grateful to you for being a nurse. Thank you for taking care of people out there,
course,
and using your voice. Please, let's stay in touch.
yes.
I would love to continue this conversation. And, we're both doing what we can to get the word out. And I want you to know that I am committed to doing whatever I can to turn this around and right the ship and advocate for Americans and patients, which is all of us.
Yeah, yes. Well, thank you for all that you do and using your voice and being the advocate and the leader that we need right now.
Thank you. I appreciate that very much. So great to meet you. Hopefully it's in person at some point.
That would be amazing.